Hey everyone, thought I'd make a quick video today. I know I haven't posted much in the way of corporate finance content or hair loss related content lately, but I'm getting back on the horse in that respect. Probably 3 months post ablation now, and it's, I guess, getting back into the groove at work has been at the forefront of my mind. So as most of you will know, corporate finance can be quite time intensive every now and then, and that's sort of the hole I've been in, and haven't obviously been able to post too much on YouTube. So thanks for all sticking by and subscribing and all that. And if you like this kind of content, please subscribe, because I will eventually get around to posting more regularly, is the intention and hope. But today I thought I'd give a quick overview of my experience with the ablation surgery. So if you want more background on my actual condition, just watch the previous video on my channel. But I thought I'd just give a quick overview of the actual surgery, just given, some people can be a bit anxious about, obviously, getting heart surgery at the best of times is a little bit confronting and makes you reevaluate things. But basically for me, what I had was a catheter ablation for SVT. And it was, once they were actually in there, they were able to diagnose that it was at AVNRT. So that was the technical term that they use, and I might be butchering it, but it's AV nodal reentrant tachycardia, which is effectively the loop that occurs, right? So basically leading up to the surgery, I was put on a drug called metoprolol, which is a beta blocker, and is sometimes used as just a medical intervention to manage the condition, because it manually slows the heart rate. And I have to admit, in the first week I took it, I was, much less anxious about it. That's probably because your heart rate's dulled to like 40, 50 beats a minute, and you can't really function too well. It was very hard to work out on that drug, I found, and I just had to sort of can it, just because, although I was just very, set on making the surgery and not, contracting anything that would potentially stop me from being able to undertake the surgery, just given there is a bit of a lead time in terms of booking these things and getting it done. But I had a guy in New South Wales who's very good. The type of surgeon that will perform is called electrocardiophysiologist. So they specialize in this type of thing versus sort of, your more generalist cardiologist in that sense. So got booked for the surgery, and then came off the metoprolol probably a week before the surgery, just so, the actual aim of when they go in there is actually try to set off the arrhythmia, because sometimes they go in and they can't set it off and, find what's causing this, the loop, which is, ultimately a pretty bad outcome. But what they can do is what they call, and I might be butchering this, but it's an exploratory an empirical ablation. So there is an area in the heart where more often than not, 80% of the time, that's what's causing the arrhythmia. There's a certain spot. So if they can't identify the exact location, then they'll just sort of singe that part, and just sort of hopefully that knocks it on its head. But for me, during this surgery, you're actually awake, and I was, it was quoted that it was roughly 8% better chance of finding the arrhythmia if you're awake. Now, when I say awake, I mean knocked out versus sedated. So I was sedated, so you can't sort of freak out and jump off the fucking medical board or whatever it is. But effectively, you go in, you strip down, you go into a room. It's very cold, so all the equipment obviously needs to not overheat and all that. So it's very cold. You got nothing on. You got a little linen over covering your groin, because they actually go through what's called the femoral vein. So they go in through there, get into your heart, and you're sedated. So you don't really feel anything apart from the sensation that you get when they're actually performing the ablation is you feel sort of a warmth inside your heart, which is pretty cool, and it's a little bit spooky. But they effectively, you go in, they put it in, they go all up to your heart, and you're a little bit dazed. It's sort of like you're almost in a trance, like you're almost about to fall asleep, but not really. I was pretty lucid, to be honest. I could hear what the doctors were saying and all that, and I could see them playing with my heart rate on the monitors that's going up to like 200, which was a very good sign, because it meant that they've actually found the, defective spot that was causing the arrhythmia. And just for everyone's, notice, this is a genetic condition. This is an abnormality that I've had since birth. And it's just something that, unfortunately some people have and some people don't. Some people live pretty well without it and other people don't. And I was getting very aggressive onsets of the episodes, and I couldn't play golf, I couldn't work out, I couldn't, go for a run or anything like that. And it was ultimately very distressing, and I was, starting to get very anxious about, even going for a walk. And then at that point, you have to make the decision for yourself, like, is it worth living a life where you're afraid to go for a walk, right? And not be too far from a hospital at any given time. And that was the decision I had to make. And, I was very happy with the ablation, right? So during the surgery, they go in, they do that, you get out, and then they wheel you out and you come to from the sedation that you've had. And what you'll need to do is they'll put like a clamp on your groin where they go in, because they need the bleeding to stop there, because the bleeding can be quite bad from the groin, because it's just a high movement area. So it's easy for it to start bleeding again there. That was the actual main issue that I had in the week of recovery, was just making sure that wasn't, too exposed, because I do a lot of gym work, I do a lot of, training and all that. And I just had to be really mindful not to push it too hard, just because I didn't want my groin to explode in the middle of the gym or anything like that, and you have fucking blood pussing out of your groin like you're like it's your time of the month or something. But I think for me, that was the main thing, was actually the groin, like just not walking around too much, just trying to take it easy. And after 12 days, you can actually sort of get back into, full unlimited exercise, if you want to call it that. But they advise against, going and doing, 200 kilogram deadlifts or squats or something, for obvious reasons. In terms of the chest pain immediately after, it was a bit tight for probably 2 days, and that's completely normal. And the reality of the situation is I've been getting what is called ectopics, so effectively skip beats in the interims, probably in the, pretty irregularly, which is good. Now, what ectopics are is they are skip beats, and I didn't get them before the ablation surgery, right? But what the electrocardiophysiologist told me was that the reason for this is because that's effectively the pathway previously that your electrical system would try to go through. And then that skip beat is that, or I guess it is a signal to them that it can no longer go through that pathway that was causing the very aggressive SVT arrhythmia. So that was, they are a little bit uncomfortable, but obviously not as uncomfortable as having your heart rate at 250 beats for, 45 minutes, stuck in the middle of nowhere or something, where you're worried you might go into cardiac arrest or something like that. So for me, hope that gives, people a good enough overview of the surgery and the recovery. It's, I'm probably 3 months post now, and it was a great decision. In Australia, it cost me $500 because I've got private healthcare and all that. But yeah, it's great to get your quality of life back and not be afraid to go for a walk or hit some golf balls or whatever people like doing in their free time. And it, this condition is, one that's very hard to diagnose, but it's very, it's not particularly lethal. It's not, the end of the world. There's obviously much worse conditions that people can have out there. But I think the thought of, having a wire stuck in your heart and burning off, parts of it, given there are very real risks associated with it if the surgery goes wrong. But if you've got a competent health practitioner that can explain those risks to you and has done, 100, 200 of them, then you should be in pretty safe hands. And ultimately, you have to weigh up the quality of life if you want to live the next, 30, 40 years scared of working out or doing anything and setting off this condition. So hope that gives people a bit of a breakdown. I'll be posting a lot more corporate finance and hair loss related stuff soon. Hopefully, look at this fresh fade. I got $8 in Strathfield. But anyway, I hope everyone's having a good day, and I'll catch you soon. Bye.